Hi, I want to talk today about whether foot orthotics can play a role in decreasing low back pain. This is a little controversial. There are some studies that show that there can be a direct relationship between foot function and low back pain. There are other studies that show that there's almost no relationship at all. What we find is that certainly not all low back pain by any means has anything to do with your feet, but there are some cases where taking care of abnormal foot mechanics really can make a difference. There's a couple hypotheses of why foot function may contribute to low back pain. One of those is if you're somebody who pronates too much, meaning rolls in too much, as you pronate, the lower leg rotates inward, and as the lower leg rotates inward, that can put stress on your knee and your hip and your back. And by using a stable shoe and an orthotic device that limits that motion, we can keep everything functioning where it should, and we don't put that stress on the back. And in some cases, that can decrease or eliminate low back pain. First thing we always want to do is to try and determine, when our patients come to the office, does it seem likely there's a relationship? If I see someone come in and they have a chronic history of low back pain, but they have perfect foot mechanics, they have a very stable foot that's not rolling in too much, the odds of their back pain being related to their foot function are really not that high. On the other hand, if somebody has abnormal foot mechanics, just for example, their foot is really flat and their legs rolling in a lot, then it's more likely that there's a relationship. I can usually test the theory by putting a taping on the foot, sending them out, stabilizing that foot, then sending them out to do an activity that causes the back pain. If we find that the back pain goes down, then there's usually a relationship. And also, if you just find that wearing a better shoe, like an athletic shoe, is better for your back than wearing, for example, a dress shoe, then it probably is a direct relationship between the foot pain or the foot function and your low back pain. So if you have low back pain, and if you have a low back pain and there's not been another reason found that you have low back pain, I would suggest seeing a podiatrist that specializes in biomechanics and at least get some testing done to see if there is a relationship. If you're in our area, please come and see us. If you are coming in, be sure to bring a selection of your shoes, and if you have any arch supports or orthotics you've used in the past, let us see those. Sometimes people have tried orthotics, but they're just basically lousy orthotics and they're not doing enough to support the foot or take stress off of the back. If you're not in our area, find a podiatrist that specializes in biomechanics. They're going to be the ones that are most likely to help you with this problem. So that's it on foot function and back pain. If you want more information, even some suggestion on some over-the-counter orthotics you can try, go to our website and just do a search for back pain. Got a lot of information there, including a number of the studies that look at this relationship. And that's it. If you like these videos, please subscribe.